My desire to be a cosmetic surgeon started when I was in college. I had always been an artist. I love to draw. I have a fine arts degree from Rice University and a medical degree from the University of Texas in San Antonio. So my plan was to blend my love of art of the human figure with the medical degree in practicing as a cosmetic physician. So now I'm actually doing something that I always dreamed of. What people need to realize is that all liposuction is not the same. When it comes to cosmetic surgeons, it really comes down to artistic ability. And that's what sets me apart. I've always been an artist. And when it comes to doing liposuction, I don't treat it just as a medical procedure. I treat it as my art. Using my artistic background and such, I've actually developed some techniques that are a little bit different from what most doctors do. Most doctors look at this like a debulking procedure, something just to make someone smaller. But as a sculptor, I'm looking at a person and looking at their figure. I'm looking for the best proportions, I'm looking for the shapeliest curves, and in taking that vision, I actually use my artistic abilities and my skills to create that vision into a reality. The main thing is having patients awake and participating in their surgery. It allows us to put people in positions that otherwise would be very difficult to get people into if they were asleep. If I'm doing areas like the tummy, I actually have patients crunch and tighten up their abdominal muscles. Fat is a soft substance that when someone's standing, it goes into bulges and folds that you can't see when someone's laying down. And when I'm sculpting, this allows me to do things in a very much more smooth and controlled manner. So I can go back, mark those areas, lay my patient down, and then continue on. And we keep doing this process back and forth until everything is perfect. That gives me the completeness and smoothness that most doctors will never achieve. And the patient actually gets to stand up in front of the mirror and see the results before they ever leave the surgery center. And what we end up with is a patient who is thrilled. We end up with shapelier curves, we end up with more completeness and smoother results.